The Bermuda Medical Doctors Association, the BMDA, has just announced the results of their survey of island physicians regarding COVID-19 vaccines. As the largest representative body of medical doctors in Bermuda, the role of the BMDA is to advocate on behalf of physicians and their patients. The COVID-19 survey, which was completed in July, was open only to local physicians with identification verified by email address. However, the answers were strictly confidential and not attributable to any individual. 71 responses were received. BMDA President Dr. Ben Lau said, quote, "To ensure we are accurately representing the views and interests of local physicians, we recently undertook a confidential survey regarding COVID-19, which illustrated that an overwhelming majority of local doctors would recommend vaccination. The pandemic," he continues, "has divided communities globally, but as physicians, our collective interest lies in the welfare of all people. We collaborate every day across practices and specialties to protect and care for individuals and collective health. We believe that individual physicians should be free to express their opinions and experience, and while the vast majority of doctors encourage vaccination, our care does not discriminate." End quote. Here's Dr. Lau on the number of physicians in Bermuda and the validity of the survey.
There are about 140 to 150 full-time equivalent physicians working on the island, and 71 respondents represents about half of all physicians. So indeed, we're happy with the response that we received, and we do feel that it is reflective of the entire community of physicians.
And the survey results say 95.7% of doctors, or 68, would recommend the Pfizer or Moderna mRNA COVID vaccine for a healthy adult without contraindications. 4.2%, or 3, would not. 90.1% of doctors, or 64, would recommend the AstraZeneca COVID vaccine for a healthy adult over the age of 40 without contraindications. 9.8%, or 7, would not. 71.8% of doctors, or 51, would recommend the AstraZeneca vaccine for a healthy adult under the age of 40 without contraindications. 28.1%, or 20, would not. 90% of doctors, or 63, would recommend the Pfizer mRNA vaccine for a healthy child without any contraindications between the ages of 12 and 15. 10%, or 7, would not. And overall, just over 97% of doctors, or 69, recommend vaccinations which do not include the COVID-19 vaccine to combat and prevent disease. Dr. Lau added this comment.
As healthcare professionals, we respect one another, and quality of care can only be strengthened by sharing our varied approaches to treating patients through evidence-based practices. The last outbreak claimed over 20 Bermudan lives. Some of the recovered are still experiencing ongoing symptoms, and COVID-19 patients are once again being admitted to the hospital and the intensive care unit. As the COVID-19 pandemic continues to worsen in many countries, further fueled by the Delta variant, we are united in our goal to provide the best outcome for all our patients.
So the Bermuda Medical Doctors Association has spoken. An overwhelming majority of local doctors would recommend vaccination for COVID-19. If you've been hesitant, well, maybe here's your sign. The next step is up to you. Diane Brewer reporting for Bermuda Broadcast.